Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece.
Welcome back. This is part 3 for chapter 58, coordinating care for patients with intestinal disorders. As you saw in outline, it's quite long, but in this video we talk more NCLEX priorities for intestinal disorders, and we have some questions. We talk about the red flags of every disease, and I have these two tables in separate slides, and you see what to do, red flags, tools to memorize, and high heel topics, what to watch for, and what the item ask you to do, classic pitfalls to avoid. As we know, the NCLEX is broken in 15 new specific areas. We have somebody that wanted to share with us the results of how it looks, the CPR, the Candidate Performance Report, in case it's not passing NCLEX. So for this, as you know, I'm always talk about it's this pie to complete plus the other new specific. So we have those domains that is traditional 8 categories, and then we have the clinical judgment, which is a huge focus on the exam. So right here, I have questions that covers all these, and we can practice how looks like and in each disease, and kind of help us to understand when we do the exam. It's easier to kind of see and where we are during the exam. So for instance, for basic care and comfort, it's 9%. So that means a question can be select all the apply, and one of the answer or two correct answer, they're basic care, and if it's not marked, then it happens to not passing this category because it's so little. And if you want to aim for 100 question, 100 question, you kind of have like 9 questions to answer, and it's a little bit challenging. But I'm going to explain in these two tables more about basic care and comfort, and in the questions I'm always focused more on basic care and comfort, since many candidates struggling with this because it's 9% here. So this is the new one that I said, the recognizes key cues, prioritize hypotheses, take action, analyze cues, generate solution, evaluate outcomes. So as I always mention, I have the booklet always in the description. You can download it from there, or you can go to the website and download it. And there are 2 booklets with this and this. Safety and infection control, it's right after the pages with where it show what I just showed with the pie. So for each chapter you're studying, you just make pop quiz for yourself and answer one or two, like each disease. If a chapter has 4 disease, 3 disease, or you just practice that in a week or two you do NCLEX, just make sure that you answer these questions like anything. Just decide 3 or 5. Usually I say 5 for individual one. 5, whatever you come up with, 5, like which disease. And safety, it's assess client for allergies. You always, as a nurse, you always ask the client and assess for allergies when give food or you give medication. You always, you look and intervene as needed. Like how you intervene in something, peanut butter comes up, or eggs, or and also, some vaccines, they have some ingredients that causes allergic reaction. If you are in home health and or you work in a clinic, community clinic, and some people, they have allergy of honeybee. So how you intervene? So you just think about each of those. Assess client care environment, promote safe staff safety. Of course, if you work in a big hospital or even in assisted living, you need to promote staff safety. How the caregiver will help the patient. Is the bathroom safe? So think about this. Just if you have experience in healthcare, or even if you don't have, you just imagine yourself, you create a little story, and just think about 5, and this will help you. You have safety and infection control, and then you have all the pie, you have a page that will help you for this. So just make your own practice. So this is the NCLEX, the big deal points. I think those are the high priority safety, educational, and prioritization points often tested, in my opinion. Like appendicitis, we talked. So appendicitis safety, never apply heat to the abdomen. If appendicitis is suspected, it increases blood flow and can cause rupture. Never give laxative or enemas, they can cause perforation. So the red flag, if a patient with appendicitis, pain suddenly reports relief or pain, suspect rupture and impending peritonitis. The stoma assessment, very critical observation. Think you must be able to identify a healthy versus unhealthy stoma, because as a nurse you have to make a skin assessment, and you need to know how this healthy versus unhealthy. So dark red, purple, or black indicates compromised blood flow, ischemia, narcosis, and requires immediate notification of the provider, of course. The post-op hernia repair is like no coughing. Unlike other surgeries, coughing is discouraged to prevent pressure on the repair. If they must cough, teach them to splint the incision with a pillow. Dietary teaching, celiac, remember the BROW to avoid. B is barley, R it's rye, O it's oats, unless certified gluten free. So the wheat, rice, corn, and potatoes are safe. Diverticulitis, know the difference between acute low fiber NPO and maintenance high fiber. No fever. Hemorrhage and shock sign in abdominal trauma or post-op patient. Watch for tachycardia. Usually the first sign. Hypotension, it's like cool, clammy skin and rigid abdomen, peritonitis. Look for Coulon's or Turner's sign as a late indication for internal bleeding. So I hope you like this little picture created by Gemini. Now we are in same chapter 58, coordinated care for patients with intestinal disorders. So here, as I mentioned earlier, the NCLEX subcategory, we have the safety and infection control, health promotion and maintenance, pharmacological and parental therapies, reduction of risk potential, psychosocial adaptation, basic care and comfort, management of care, psychosocial integrity. I usually start with management of care, but today I started with infection control. So as you see, the what to watch for: aseptic technique for colostomy care, prevention of peritonitis after bowel perforation, post-op hernia repair, infection prevention. We just said earlier. Let's go back to let's continue. What item asks you to do? Select intervention to prevent infection or injury. So the pitfall to avoid: ignoring early signs of peritonitis, fever, rigid abdomen, and bowel perforation. So this would be like a case study in case you get a case study, and the patient will have the signs and you observe the signs. So you need to know the classic pitfalls that to avoid. In bowel perforation, like failing to change ostomy pouch when it's 1/3 full. This is very classic question for quizzes, especially for the LVNs. And I've seen this in even ATI. Every practice exam, they have these. This is the correct answer. Is one of the options. So this is the correct answer. Basic care and comfort. I'm always go after this. Ostomy care, positioning to relieve bowel obstruction discomfort, dietary adjustments for celiac disease. So this is what to watch for. For what the item asks you to do: select intervention to improve comfort and function, and to avoid, recommending a high fiber diet during acute diverticulitis, flare, ignoring psychosocial distress from a new stoma. This is very common, ignoring the psychosocial distress from new stoma. This is very common here in quizzes everywhere. So this is very common here. So you see, I have just two examples here with safety. You saw the list is long, but I put 1 or 2 example wherever it came up. But as you saw, the list is long, so you need to make more for yourself. This is just to kind of see how it looks like. And let's go for management of care. coordinating multidisciplinary team for colorectal cancer surgery, post-trauma, abdominal injury management. Prioritize team-based intervention and delegation, and classic pitfalls to avoid: delegating stomach teaching to unlicensed personnel, so RN do the teaching. Delaying nutrition consult for post-op bowel surgery, so be careful here. Psychosocial integrity, supporting patients with body image changes after ostomy, anxiety with a new cancer diagnosis. This is very important for each chapter, but also in your own practice, because the body image with any changes, anything, wound care or ostomy or any that patient have and go through, this is very important to support patient. It's a good it's a good bedside manner. And classic pitfalls to avoid: minimizing patient concern, providing false reassurance instead for active listening. This is also very common in quizzes, ATI and Kaplan. When you do, even for LVN, this is also very common for the RN. There are some questions when it's like, oh, you are fine, it's just momentary. No, you need to be active listening, not to reassurance. Okay, we go furthermore. This is a different table, but I used that CPR, the Candidate Performance Report, and I go management of care. So now it's first safety and infection. So as you see here, the table is long because I wrote a lot here. The red flag traps, tools to memorize. So take a short screen. I take my little light out. Take a short screen because this it's 3 slides about these slices. Pizza. Well, this is made also in that circle as a pie. Pecan pie. Well, it's too early to think about food right now. So for me right now when I record, it's 5 o'clock in Monday the 29th December 2025. So I woke up at 3 o'clock in the morning to do records and this. So yay, yay me. So basic care and comfort. So let's read this little bit together. I know it's small because the table, it's how to say, it's a lot of information in this table, so that's why. So basic care and comfort, so it was 9% in NCLEX. Positioning, head of bed 30 to 45 for nausea respiration prevention, but this is for even for a patient when it's in hospital or at home. It's good to have the head of bed elevated. It's always good for all of us, unless is not indicated for this elevation. For us, we can sleep flat, but we have a pillow, so it's a little bit elevated, right? For nausea, aspiration prevention, as you see, left lateral for flatus facilitation. So skincare, so make sure skincare no matter what. Barrier creams for diarrhea, ostomy. So for barrier creams for diarrhea, let's think about it. If a patient have diarrhea, or even for incontinent patient, think that even babies, they have this breath that keep the moisture and then make it thin the skin. Imagine that. Then you need to put a diaper rash. So Balmex, it's mostly common in home health and hospice because it's less with zinc oxide, but there are other diaper rash, they call it, the barrier creams, and have a higher zinc oxide. It's beneficial too. Let's see, gentle cleansing. This, of course, always you need to make sure the patient is um, um, clean. Manage hemorrhoid discomfort, sitz bath with hazel pads. So sitz pads also it's for pregnancy, but we are not talking about that in this chapter. Nutrition, small frequent meals post-op, low residue during acute diverticulitis, then gradual fiber to reintroduction. So this is like IBS trial low, the food map with dietitian. And the red flags, laying patient flat after large meals with ileus risk, using harsh soap on peristomal skin, which will get to dermatitis. Then we have another red flag, focusing oral intake with severe ileus / obstruction. So just memorize that bowel sounds normal. You have between 5 and 30 minutes. Hypo, it's less than 5. Hyper, it's more than 30. Sitz bath 10 to 15, 2 to 3 times a day for hemorrhoids per order. So sitz bath, think about it's like a cold bath. Same when you have a for a leg or leg. Can be any can be in an arm, any joint. If a patient has like a sprain, then think about cold pads. Same, it's like around 15 minutes, and you repeat the circle a few times, not keeping the cold packages or even heat pad packages more than 15 minutes. Sometimes some books says 20, but just to be on the safe area, around 15 minutes. So now we go with the same table, but we continue with the other NCLEX domain. You see here we have the continuous. We get in the clinical judgment and recognizing cues here. Let's go to recognizing cues. So bowel obstruction, colicky, pain, obstipation, high-pitched sounds, distension, vomiting, early SBO, so small bowel obstruction versus late feculent emesis, the LBO, the large bowel obstruction. Appendicitis, pain migrating to McBurney point, rebound to Rovucine, low-grade fever. So if you want to know about these keywords, go in the part 1 terminology. I have like nice pictures there. It's different than before. Diverticulitis, you see low left lower quadrant pain, fever, leukocytosis, avoid rectal exam in suspected acute diverticulitis. So we have the celiac, chronic diarrhea, steatorrhea, iron deficiency, anemia. You see, like, to memorize points, like McBurney point location, roving sign. So just look back what that means in case. So you see, let's go back. Let's go next. So this is the last part from that 15 categories. I call it domains. You see, evaluate outcome. We always want to make sure that the patient is stable and no fever and understanding the disease. So bowel function returns, flatus stool, pain control, digestion, decreases, NG output tappers. Patient tolerate diet advancement without nausea and vomiting, infection resolve, afebrile, white blood cells trending down, soft abdomen, no peritoneal sign, and with celiac, symptoms, readmission, weight stabilization, correct deficiencies. So to remember, this is like the urinary output. So this is like 0.5 ml per kilogram per hour, but usually it's around 30 ml. For adults, lactate, normalization, discharge, checklist, diet meds, wound ostomy, follow-up, danger sign. So this was the long list from that 15 NCLEX domain, and I have, like, as you see, about 4 or 5, 2 here, 2 here, examples that I talk about, but can be more. So this is just very quick examples from my outlines that I created for myself. So this is for me to share with you what I study and help me out. So now we go into the NCLEX questions and answer. This one, in this video I made 22 questions. The chapter is quite long and it's good to practice. Now I start with the heavy one, in my opinion. So the first few questions, they're select or apply, and as we go, we're gonna see easier one. So this question, colorectal cancer, we have the 2 domain, but probably there are more. So imagine if you have to do that pie, and now you have the select or the apply. So let's see how which answer belong to which category. So let's start. The nurse is providing discharge teaching to a client who is recovering from abdominoperineal resection with the creation of permanent sigmoid colostomy. Which statement by the client indicate a correct understanding of the instruction? Select all the apply. I should expect my stool to eventually become formed. I will empty my ostomy pouch when it's 1/3 to 1/2 full. If my stomach turns dark red or purple, I will contact my doctor immediately. I should expect my stool to remain liquid and green for the rest of my life. It is normal to see a small amount of bleeding from the stomach when I'm cleaning it. So as you see, these are examples from what I just read earlier in the examples that I create in that table. So you see it's an example from there. So the correct answer are, I should expand my stool to eventually become formed. I will empty my ostomy pouch when it's 1/3 to 1/2 full. If my stomach turns dark red or purple, I'll contact my doctor immediately. And it is normal to see a small amount of bleeding from the stomach when I'm cleaning it. Correct answer. And the rationale why option A is correct. The test states that the final consistency of the stool depends on the location of the ostomy. For a sigmoid colostomy, the stool is described as formed. So, and I explained this also in the key terms. I have pictured that. Reduction of risk potential, so safety and complications. Option B, the appliance should be emptied when it's 1/3 to 1/2 full to decrease the risk of the appliance detaching from the skin due to the weight of the stool. Option C, a stomach should appear reddish pink and moist. A dark red, purplish, or black color is a sign of ischemia, lack of blood flow, and must be reported to the provider immediately. So the as you see here, the option E is correct. The text notes that the slightly bleeding from the stomach is not unusual initially, particularly during cleansing or appliance changes. So the incorrect option, the D, liquid to semi-liquid stool is characteristic of an ileostomy or ascending colonostomy, not the sigmoid colonostomy. So that's why was the wrong D. Another question with two domains: inflammatory bowel disease. A client with moderate to severe Crohn's disease is prescribed adalimumab, Humira. Which instructions are essential for the nurse to include in teaching plan? Select all to apply. You will need to undergo tuberculosis, the TB screening before we start this medication. Then the medication is given as a subcutaneous injection, so you should rotate your injection sites. If you develop a fever, cough, or sore throat, notify your healthcare provider immediately. You can safely receive live virus vaccines such as nasal flu mist while taking this drug. You should avoid large crowds and people who are sick to reduce your risk of infection. So think about the NCLEX style question focusing on and this question targets the critical domains, so be careful on that. So the correct answer are, you will need to undergo TB screening before we start this medication. This medication is given as a subcutaneous injection, so you should rotate your injection sites. If you develop a fever, cough, or sore throat, notify your healthcare provider immediately. And you should avoid large crowds and people who are at risk to reduce your risk of infection. So these are the correct answers. And the rationale is like safety and infection control. It's the option A. Biologic therapies like adalimumab suppresses the immune system. The text explicitly states make sure patient was evaluated for TB before beginning treatment because those drugs can reactivate latent tuberculosis. Option C, because the immune system is suspected, the body cannot fight infection as effectively. The text wants to monitor for and immediately report signs and symptoms of infection, etc., making early reporting crucial. Option E, the text advises patient on those medication to avoid people with infection to minimize exposure to pathogen. The pharmacological and parental therapy, the option B. So the text specifies that Humira is administered by subcutaneous injection only. Rotating sites is a standard nursing instruction for subcutaneous injection to prevent tissue damage and ensure absorption. So why D was incorrect? Because while the text doesn't explicitly list every vaccine, it notes that biologics after a person's immune response, standard safety guidelines contraindicate live vaccines like MMR and nasal flu mist for immunosuppressant patients because the virus could replicate and cause actual disease. So moving next. Question 3, celiac disease, basic care and comfort. Evaluate outcomes. The nurse is caring for a client newly diagnosed with celiac disease who has been following a strict gluten-free diet for 3 months. Which client statements indicate effective symptom management and adherence to the plan of care? Select all the apply. I have switched to using corn and rice flour for my baking. My stools are less foul-smelling and no longer float. I make sure to buy wheat-free and bread because I know it is safe. I have been taking my prescribed iron and vitamin D supplement daily. I still feel very fatigued, but I know that is normal for the first year. Correct answer are I have switched to using corn and rice flour for my baking. My stools are less foul-smelling and no longer float. I have been taking my prescribed iron and vitamin D supplements daily. So the correct answer is A, B, D. Here is the rationale, the basic care and comfort. So this question has 2 options for basic care and comfort. The cornerstone of the life of care is a lifelong gluten-free diet, which forbids wheat, rye, and barley. Corn, rice, the buckwheat, and quinoa are safe alternatives that provide comfort by preventing gastrointestinal symptoms like bloating and pain. D, also it's basic care and comfort. This is correct because damage to the intestinal villi causes malabsorption. Basic care includes correcting nutrition deficits. Iron and vitamin D supplements are often required to treat anemia and prevent bone loss, osteopenia, osteoporosis. So the evaluate outcomes is option B. It's correct because clinical manifestation of active celiac disease include diarrhea and steatorrhea, foul-smelling fatty stools. A report that stools have normalized indicates that the intestinal mucosa is healing and absorption has improved, demonstrating a successful outcome. So you can read the incorrect options why in here. So let's move next. Now we are in much easier questions. So question 4, bowel obstruction, psychosocial adaptation. An adult presents with colicky, abdominal pain, abdominal distension, vomiting, and obstipation. Which initial action is the nurse priority? So administer oral fluids to prevent dehydration. Keep NPO, insert the NG tube for decompression as ordered. Encourage ambulation to stimulate peristalsis. Provide a high fiber snack to relieve constipation. Correct answer is keep NPO, insert the NG tube for decompression as ordered. This is correct because obstruction requires bowel rest and decompression. Oral intake and fiber worsen distension. Ambulation is supportive but not priority before decompression. The text explicitly states initial management includes the placement of NG tube. The patient must have nothing by mouth. NPO. Question 5. Hernias, domain reduction of risk potential. An older adult with a non-inguinal hernia reports sudden severe groin pain, a tender, irreducible mass, nausea, and vomiting. Priority action. So the nursing priority action is one of the following. Apply truths and reevaluate in the morning. Think yes or no. Attempt manual reduction at the bedside. Yes or no. Notify the provider immediately of possible strangulation. Yes or no. Teach to avoid lifting about 10 pounds. So correct answer is notify the provider immediately. Because it's possible strangulation. So irreducible, painful hernia with systemic symptoms suggest strangulation. Leads to surgical emergency. Do not attempt reduction or delay. The text identifies strangulation as a medical emergency requiring immediate surgery. The correct priority action is C. Notify the provider. Question 6. Hemorrhoids, domain, basic care and comfort. An adult with painful external hemorrhoids after recent constipation asks how to reduce discomfort. Which instruction is best? So think what we said about this, and this can be in the real life, not just NCLEX. Take stimulant laxative daily. Use its bath and stool softener. Avoid straining. Increase weightlifting to strengthen the pelvic floor. Limit fluids to reduce stooling frequency. Use its bath and stool softeners. Avoid straining because the warm sitz bath decreases pain. stool softener. So here it's a warm sitz bath, but they can be also cold, but we don't want the cold sitz bath here. We want warm stool softener, and avoiding straining prevent trauma. Stimulant, laxatives, and fluid restriction worsen symptoms. Heavy lifting increase venous pressure. So the text lists its bath, fluid, and fiber intake and stool softener as a conservative treatment. Question 7 for irritable bowel syndrome, domain health promotion and maintenance. So, teaching a newly diagnosed adult with IBS. Which statement indicate correct understanding? IBS causes intestinal inflammation and bleeding. Yes or no? I will track triggers and may try a low FODMAP diet with a dietitian. Yes or no? Daily NSAIDs help my abdominal pain. I should follow a high fiber diet during acute diverticulitis flare. Correct answer is I will track triggers and may try a low FODMAP diet with a dietitian. I have it in examples. So IBS is a functional, no mucosal inflammatory bleeding. So the low FODMAP and trigger identification are evidence-based, so diary, right? NSAIDs can irritate GI tract. Diverticulitis management differs. The text emphasizes keeping a diary to identify triggers and using a low FODMAP diet. It also confirms the IBS is a functional disorder, meaning no inflammation. Question 8. Inflammatory. We are again in inflammatory bowel disease. Domain pharmacological and parental therapy. So it's different NCLEX domain here. An adult hospitalized with a moderate ulcerative colitis flare receive NURS. Which interventions are appropriate? Select all the apply. Initiate the FTE prophylaxis per protocol. Start NSAIDs for pain control. Administer corticosteroids as orders for induction. Screen for tuberculosis before initiating biologic therapy. Encourage a high fiber diet immediately. Correct answers. Initiate VTE prophylaxis per protocol. Administer corticosteroids as orders for induction. Screen for tuberculosis before initiating biologic therapy. So those are correct. So the IBD flares carries a high VTE risk, leads to prophylaxis. So the steroids are used short term for induction. TB screening is required before biologics. NSAIDs can worsen bleeding. High fiber is avoided during acute flares. The text mentions that TB screening for biologics using corticosteroids for exacerbation and the risk of VTE, which is the venous thromboembolism. Question 9. We're getting there, so we have 22. We're not half yet. Question 9. celiac disease. So here is like for patient education. An adult with newly diagnosed celiac disease asks about diet. Which food selection should correct the understanding? Barley, soap, and rye toast, garlic, chicken, rice, and steamed vegetables. Wheat pasta with marinara and malted milkshake. Grilled chicken, rice, and steamed vegetables is correct answer. Usually this you see in quizzes, um, in exams. It's very common. Grilled chicken, rice, and steamed vegetables always in the quizzes and it's correct answer. So a strict gluten-free diet excludes wheat, barley, rye, and malt. Rice is safe. Chicken and vegetable are naturally gluten-free. The test clearly states to avoid wheat, rye, and barley while listing rice as safe. So was also earlier I said as example. Question 10. Diverticulitis, management of care. An adult with acute and complicated diverticulitis is managed outpatient. Which instruction is the most appropriate initially? Begin a high fiber diet immediately. Clear liquids advancing to low residue as tolerated. Perform daily enemas until pain resolves. Start vigorous exercise to stimulate bowel function. Correct answer, clear liquids advancing to low residue as tolerated. And acute diverticulitis requires bowel rest, clear liquids, low residue. High fiber is reintroduced only after inflammation subsides. Enemas, exertion, increase perforation risk. The text advise a clear liquid diet until symptoms subside for acute cases. Question 11. Appendicitis, recognizing cue. So a young adult reports periumbilical pain migrating to the right lower quadrant, fever, anorexia, and rebound tenderness. Which additional finding most strongly support appendicitis? Pain, relief of pain with heat application, positive roving sign, generalized pruritus, high-pitched bowel sounds throughout. So the positive roving sign. So the roving sign is the right lower quadrant, pain with left lower quadrant palpation. So supports appendicitis. Heat can risk perforation. Pruritus is unrelated. Bowel sounds may be decreased. The text defines roving sign, pain in the right lower quadrant when the left is palpated as a sign of appendicitis. Question 12. Colorectal cancer, domain reduction of risk potential. So here we have during screening, which report from a middle-aged adult requires the most urgent evaluation for possible colorectal cancer. A. Intermittent constipation relieved by fiber, painless rectal bleeding with iron deficiency anemia, occasional hemorrhoid flare after heavy lifting, abdominal cramping after spicy foods. Correct answer is painless rectal bleeding with iron deficiency anemia, because painless bleeding with iron deficiency anemia. It's a classic worrying for colorectal cancer and warrants expedited workout. The test lists blood in the stool and anemia as clinical manifestation. Identify those as urgent worrying signs. Question 13. Abdominal trauma, safety and infection control. After a high-speed collision, an adult with abdominal ecchymosis has tachycardia and hypotension. What is the nurse's priority? Insert a nasogastric tube, NG tube, and begin internal feeding. Prepare for fast ultrasound while initiating large ball IV fluid resuscitation. Administer oral analgesics and reassess in 30 minutes. Encourage ambulation to reduce ileus risk. Correct answer is prepare for fast ultrasound while initiating large bore IV fluid resuscitation. I said that in my outline. Then suspected intra-abdominal bleeding, rapid assessment, fast, and hemodynamic resuscitation. Oral meds, feeds, and ambulation are unsafe if unstable patient. So you see here safety infection, like to provide safety. The text prioritize airway breathing circulation and mention using fast focus abdominal sonography for trauma and fluid resuscitation. Here we have question 14. Ostomy care post for post surgery. Domain is basic care and comfort. So the nurse teaches a newly discharged adult with ileostomy. Which statements indicates correct understanding? Select all the apply. I will empty the pouch when it is about 1/3 full. If my stomach turns dusky or black, I should call my provider immediately. I can use harsh soap to clean the peristomal skin for better adhesion. I should increase fluids and be alert for signs of dehydration. Gas and liquid output are suspected, especially early on. Correct answers are: I will empty the pouch when it's about 1/3 full. If my stomach turns dusky or black, I should call my provider immediately. I should increase fluids and be alert for signs of dehydration. Gas and liquid output are expected, especially early on. So these are correct answer A, B, D, E. Empty 1/3, dusky black stomach is emergent. Ileostomies have high fluid electrolytes loss. Encourage fluids, early gas liquid output is expected. Avoid harsh soap. The text supports emptying the pouch when it's 1/3 to 1/2 full. Reporting dark stomach, ischemia, and monitor for fluid loss, especially with ileostomy. Question 15. Hernia repair post-op, health promotion and maintenance. This is the NCLEX domain. An adult is post-op day 1 after laparoscopic inguinal hernia repair. Which instruction is most appropriate? assume heavy lifting as tolerated to strain and repair. This never. For any post-op heavy lifting, it's not it's not recommended. Cough vigorously to prevent pneumonia. Limit lifting about 10 pounds for the less than 10 pounds for the time specified by the surgeon, and use stool softeners. Avoid walking to prevent the incisional pain. So lifting less than 10 pounds for the time specified by the surgeon, and use stool softeners. So avoid heavy lifting per the surgeon timeline. Stool softener prevent straining. Encourage gentle ambulation, splinted cough, not vigorous. The text specifically says avoid heavy lifting for several weeks, and to use splitting if coughing is necessary. Coughing is generally discouraged in here. Question 16. For the IBD biologic therapy, domain pharmacological and parental therapies. Before the first infusion of an anti-TFF biologic for Crohn disease, which assessment is most important? History of penicillin allergy, TB, and hepatitis B screening results. Last colonoscopy tape presence of external hemorrhoids. Correct answer is TB and hepatitis B screening results, because the biologics increase infection risk. Screening for latent TB and hepatitis B before therapy. The test explicitly states make sure patient was evaluated for TB before beginning treatment. Question 17, we're getting closer. Question 17 out of 22. Celiac disease, domain evaluate outcomes. Which finding best identifies effective management of celiac disease after 6 months of dietary teaching? Weight loss of 10 pounds, normalization of iron and vitamin D levels, daily loose oily stools, increased fatigue. Correct answer. Normalization of iron and vitamin D levels. So strict gluten-free adherence improve nutrient absorption, which we get labs will normalized. Weight loss, steatorrhea, and fatigue suggest poor control. The test mentions anemia and vitamin deficiencies as complication. Therefore, normalizing those levels indicate the diet is working. Question 18. Diverticular disease. We have NCLEX domain management of care. An older adult on anticoagulation presents with painless hematochezia, suspected of being from diverticular bleeding. Initial nursing action should include which combination? Type screen large IV access, monitor hemodynamics, administer a high fiber diet and ambulate, start iron supplements immediately and discharge. Why discharge so quick? Place ice packs on the abdomen to give opioids. Oh my god, opioids. So type and screen large bore IV access, monitor hemodynamics. So this the rationals, it's GI bleeding priorities, hemodynamic stabilization, IV access, lab diet, and discharge are unsafe. Eyes opioids don't address bleeding. While the text focus on infection, it lists hemorrhoids as a complication. Standard nursing priority for any bleeding, as seen in the trauma section, is fluid resuscitation and stabilization. Question 19. Celiac disease domain psychosocial integrity. A young adult newly diagnosed with celiac disease tells the nurse, I am terrified to go out to dinner with my friends now because I don't want to be that person who asks a million questions about the menu. It is easier to just stay home. Which nursing response is the most appropriate? You should eat a large meal before you go out so you won't be tempted to eat gluten. It is important to realize that social isolation can occur, but joining a support group can help you learn strategies for dining out. If you stick to salads and grilled meats, you generally don't need to ask the server any question. You are overreacting. Most restaurants today have gluten-free menus and are happy to accommodate you. So thing is psychosocial integrity. So the correct answer, it is important to realize that social isolation can occur, but joining a support group can help you learn strategies for dining out. So the text emphasized that access support groups for anything, not just for celiac disease. So part of celiac acronym is a key management element because patients often struggle with the lifelong adherence and lifestyle changes. Isolating oneself is a common psychosocial complication. Connecting with peers provide practical strategies and emotional support. Option A promotes isolation. Option C is unsafe. Cross-contamination risk. And option D minimizes the patient feelings. Question 20, diverticulitis, the NCLEX domain analyzes Q. The nurse is assessing an 82-year-old client with a history of diverticulitis. The family reports the client has been more confused than usual and has fallen twice today. The client's temperature is 98.6 Fahrenheit. It's about 37 grades Celsius. And the abdomen is soft. Which analysis of those cues is most accurate? The client is likely dehydrated and needs increased oral fluids. This is like in the case studies when you have like 6 parts of a case study, kind of that look feels like the client is expecting normal age-related cognitive decline. The findings are consistent with a potential infection despite the lack of fever. The client is exhibiting signs of bowel obstruction. Correct answer is So the findings are consistent with a potential infection, this with the lack of fever. So the text states that in older adults do not always show classic signs of infection and may present afebrile with a normal white blood cells count. The first signs that may appear in the older adult patient is a change in mental status, confusion in this case, or falling. The nurse must analyze the confusion as a potential cue for diverticulitis infection rather than dismissing it. Oh, we're getting close. Question 21 out of 22. Abdominal trauma. Prioritize hypothesis. A client arrives in the emergency department following a motor vehicle collision. The nurse notes extensive bruising around the umbilicus, so that is the colon sign, and the client is tachycardic. Which hypothesis should the nurse prioritize? But in NCLEX might not say this word, but kind of it's rewarding. The client has a ruptured bladder. The client has a retroperitoneal hematoma. The client is expressing intra-abdominal hemorrhage. The client has developed a paralytic ileus. So think about the sign umbilicus. So the client is experiencing intra-abdominal hemorrhage. The text explicitly identifies ecchymosis, bruising around the umbilicus, which is calling sign, may indicate intra-abdominal hemorrhage, while bladder injury or ileus are possible in trauma. Hemorrhage is the immediate life-threatening hypothesis. Circulation, ABC, that requires prioritization. We're in the last. Irritable bowel syndrome, the IBS, domain generates solution. The nurse is creating a discharge plan for a client with IBS-D, diarrhea dominant, who reports that stress triggers their symptoms. Which combination of intervention should be included in the plan of care? Select all the apply. Encourage the client to keep symptom and diary food diary. Teach the client to limit fluid intake to reduce loose stool. Recommended peppermint oil capsule or tea as a natural antispasmodic. Instruct the client to consume a diet high in FODMAPs. Refer the client for cognitive behavioral therapy, the CBT, or stress management. The correct answer are: encourage the client to keep a symptom and food diary, recommend peppermint oil capsule or tea as a natural antispasmodic, and refer the client for cognitive behavior therapy or stress management. So the correct answer is generating solution for IBS involves a multi-phase approach. Diaries helps identify triggers. Peppermint is a natural antispasmodic supported by the text. Stress management is effective because stress has been shown to alter gastrointestinal mobility. Fluid should be increased, not limited, to prevent dehydration. And the diet should be low, not high, in FOD maps. So we just completed a comprehensive review of chapter 58. So this was the part 3. So we end here with a patient with intestinal disorders. So you have practice question covering safety and infection control, like appendicitis, peritonitis. We practice psychosocial adaptation, like bowel obstruction, ostomy care, psychosocial integrity, body image. On IBD, we have reduction of risk potential, complication of surgeries. So that's it for today. Thank you for watching to the end, and thank you and good luck with your NCLEX preparation. You are doing a great job. We all breaking down those rationales, isn't it? Team effort team. So thank you and bye for now.
We finally made it!
Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.